South Korea on Tuesday reported another COVID-19 figure close to 100,000 as the country heads towards the peak of the Omicron wave, which the authorities forecast for late this month or early next month. Still, the health authorities are saying that it is now at the early endemic transition phase, given that Omicron's fatality rate is around 0.13%. Bo-kyoung reports.
South Korea saw 99,573 new cases of COVID-19 on Tuesday. The tally increased by more than 4,200 compared to the previous day. It is also a 1.7-fold increase on week. The number of critically ill patients remains at 480. Authorities revealed that 98.9% of infections confirmed last week were the Omicron strain. And on Jeju Island, the variant accounted for 100% of last week's infections. Officials forecast that Omicron will hit its peak in late February or early March, when they expect up to 270,000 daily cases. Yet health authorities say the country is now seeing an exit from COVID-19, given that the fatality rate of Omicron is around 0.13%, much lower figure than 0.7% for the Delta variant.
For now, we've gone to the initial stage of switching to an endemic management system while keeping a check on Omicron's degree of risk. If we keep the low fatality rate and manage to curb the spread, eventually Omicron will also be dealt with like other infectious diseases.
Officials added that vaccination is effective in preventing severe illness and death, given that the unvaccinated, who only account for around 6% of the total population, made up more than 60% of severely ill patients and deaths over the past 8 weeks. Meanwhile, the government is to have 200 more delivery beds for pregnant women within this month, as there have been several cases where expectant mothers with COVID-19 or who have had close contact with a confirmed patient could not find hospitals to deliver their child. For schools, education authorities said on Monday that schools can freely implement online classes or adjust school hours during the first 2 weeks of the spring semester from March 2nd to 11th. Initially, schools were advised to switch to online classes if 3% of all students at a school were infected, or if 15% of all students in a single grade were absent due to infection or self-isolation. Bo-kyoung, Arirang News.